First, let's welcome Dr. Andy Smith of Novant Health Surgical Associates. Welcome to the show today, Dr. Smith. It's such a pleasure to have you.
Thank you. It's great to be here.
Great. Well, I always start off by asking my guests to tell me about their education and their background. So that's where we're going to start today. So I'll let you go.
Great. So I grew up in East Tennessee and went to undergraduate school at University of Tennessee in Knoxville. I was a biochemistry, cellular, and molecular biology major there.
Oh my.
From there, I went down to Memphis and went to medical school at the University of Tennessee College of Medicine, which the main campus is located in Memphis. So 4 years there. And then after that, matched into my residency at New Hanover Regional Medical Center in Wilmington.
Right up the road.
Right up the road. That was my first introduction to southeastern North Carolina. And I spent 5 years there. At that point, met my wife and we got married and moved to Charlotte. And I was in Charlotte for 4 years with Carolina's healthcare system. And then my wife had a constant pull to get back to the coast, and so we made the move back this summer.
Your wife wasn't from the coast?
No, she was.
Oh,
yeah, she grew up down here, so it was, you know, pretty much
nice.
from
so
day one.
So she kind of wanted to come home.
It was, why did you take me away from the coast?
Yeah, yeah. Did you always want to be a doctor?
You know, I think so. It's an interesting question. I was the first person in my family to go into medicine. My dad was an engineer, so you know, I grew up around science for sure, and liked it. But wasn't until I was able to follow a orthopedic surgeon around, believe it or not, when I was in high school, and really got interested in that, and then went on to medical school, and you know, fell in love with my general surgery rotation. So,
wow, that's nice. And I was going to ask you what brought you back to the area, but you kind of already told me that your wife was from this area, right? That's
right. That's right. Yeah, she was born and raised in Wilmington, and of course that's where we met. And then her parents are still down here, and Charlotte was great, but like I said,
it is a great city.
I think for people who have grown up here and are used to the things that this part of the state offers you, you know, it's hard to leave it. So
yeah, it is. It's a great place to live. We love it here. My husband and I have been here like 20 years, and my only regret is that we didn't come before that. Right.
Well, I've been told I need to buy a boat. That's probably the next big step.
Yeah, that'll be your next.
Not yet.
Well, talking about your experience, I know that the vast majority of your experience is in general surgery, and I wondered what drew you to general surgery?
You know, I think what I liked most about it when I was going through medical school trying to figure out, you know, what it was I wanted to do, you know, for me, surgery was the tangible effect of the outcome of taking care of a patient. You know, people will come into the office with a problem, we take them to the operating room and fix it.
Kind of like a mechanic.
Kind of like a mechanic, and maybe it's that engineering background my dad had.
I think that's what it is.
But, you know, it just, to me, that was the most tangible success in medicine was really being able to fix someone, you know, physically, and I just fell in love with it.
Yeah, that makes sense. Let's talk a little bit about the most common surgical procedures that you perform.
Sure. So a broad range of general surgery. You know, I'll operate on anything from skin disorders, which include skin cancers and, you know, lipomas and lesions like that. Thyroid disease, we do thyroid surgery. Of course, you know, as a general surgeon, we describe ourselves as the skin and all of its contents as far as what we take care of. But the gastrointestinal tract, stomach, small intestine, colon surgery. Of course, we do colorectal and hemorrhoid surgery as well. And then I also offer some vascular procedures in addition to that.
But something like gallbladders and appendix and all that, that would be within that.
That's right. That's the bread and butter of general surgery. So, you know, we love taking gallbladders out. We love appendix. That's what keeps our doors open.
Wow. I know lately we hear a lot about minimally invasive procedures. So talk to me a little bit about that. Is that something that you offer?
It is. I'm trained in laparoscopic and robotic procedures. We do have the Da Vinci robot at Novant, and that's part of that minimally invasive technique that we offer. These are common, you know, minimally invasive approaches are common in things like gallbladder surgery, colon surgery, some small intestine surgery. And then, of course, hernia surgery has really taken off from a minimally invasive approach as well.
But all minimally invasive procedures are not done via the robot. Is that correct?
That is correct. There is some overlap. There are some laparoscopic procedures that have classically been laparoscopic, so that's
Right.
very similar to the robot, but without using the actual robot. That some people still may do laparoscopically, some people may do robotically, some people feel there's some advantages to each. There are certainly some procedures that I feel are very advantageous to use the robot for, and so primarily I will offer robotic approaches for those.
This may be a stupid question, but I'll ask it anyway. Is there ever a time when you might use both procedures in the same, or both techniques in the same surgery?
That's a great question. And actually the answer is yes. A lot of times if we're doing a pretty complicated or difficult case, we may start out robotically. If it's something that can't be done with the robot easily, we can convert to a laparoscopic procedure, which is actually a fairly unnoticeable difference for the patient. It's the same number of incisions, it's the same recovery. We just use the laparoscopic technique rather than the robotic technique. It may offer us a little bit different angle or perspective on the case than the robot would.
I did hear that oftentimes or sometimes the recovery might be a little quicker if it's done robotically or minimally invasive, of course.
Right, and that's accurate. What the data looks at is hospital days and pain scores primarily post-operatively. And we've seen that with minimally invasive techniques, that's laparoscopic and robotic. And in some cases, robotic is better than laparoscopic, certainly, like I was saying, for some of these particular procedures. But we see fewer hospital days, so fewer nights in the hospital after surgery, less pain after surgery, and overall a quicker recovery to normal activities.
And that's something you would decide at the time when you are examining the patient. You would offer whatever's best for the patient.
Of course. As we all know, everybody's different. Every patient's different. Every patient's got a different medical history and a different surgical history. So, you know, what we may offer one patient may not make sense for somebody else, and we want to treat you that way as an individual patient and go through that with you on a specific basis.
You briefly mentioned vascular procedures. So talk to me a little bit about that. I know you have an interest in vein procedures, and I understand that very soon they'll be offering those procedures at Novant Health Brunswick Medical Center. So talk to me about some of those procedures and what that's kind of like.
Sure. So the traditional vascular procedures that have been done, and a lot of these have been done through open incisions, but carotid artery surgery and then lower extremity bypass surgery for blockages in the arteries of the legs. They've been doing those for a while now at Novant. I perform some endovascular approaches to that, which is essentially the minimally invasive version for arterial surgery. So we do it with wires and catheters and balloons and stents and things like that. As far as the vein work goes, we are going to start a vein program which will be able to treat varicose veins and diseases such as venous insufficiency, which can lead to a lot of leg swelling, pain, ulcers, and chronic problems in the legs.
Talk to me a little bit about the vein surgery. I've heard the term stripping of veins, and what's the most common procedure there?
Sure. Traditionally, vein stripping was a very common procedure. It's how we dealt with.
That was in the old days, right?
That's the old days. That's but still, again, occasionally a good option now. It's how we deal with some painful varicose veins, and sometimes if we have a long segment of a bad vein or bad reflux in a vein, we can treat it that way. There are some newer techniques which are great. We use radio frequency ablation techniques, which is again kind of getting back to that endovascular type of procedure where it's minimally invasive. It can be done in the office under local anesthetic. We put a wire in and we'll actually use a radio frequency to heat up the vein and ablate the vein so that it scars the vein down and can redirect the flow through more competent veins that don't give us some of those problems that the vein in question may be causing.
Well, that's what I was going to ask you. If you take the vein out, then what happens? What replaces that? How does that work?
So our body's kind of set up with natural bypasses, if you will. We have a lot of veins in our legs. There are some main highway veins, some interstate veins, and then there's some back road veins. And if we have a highway vein that's not functioning as it should, we can kind of take that vein out of circulation, okay?
Really?
And that's with that RFA procedure that we described. And what that does is it reroutes a lot of that blood flow into some of these other pathways.
So it'll just automatically, it just knows to do that?
The body is pretty amazing,
Very cool.
and taking something away, like a large vein in the leg that may be causing some problems, the body will figure out a way to reroute that blood through smaller veins, and those veins can enlarge over time and take over the job of what this malfunctioning vein was doing.
Wow. Have you ever taught? You sound like kind of sound like a teacher.
Well, I think there's a lot of teaching in medicine. If
Yeah, there is.
if you're explaining things to your patient the way you ought to, then I think it comes out, a lot like that sometimes. And,
Yeah.
part of our job is to be able to take things that it took us a lot of years to figure out and to understand, and try to put those into some terms that a patient can understand. And to me, that's part of the fun of my job, is being able to relate in that way with
Well, you
patients.
do a great job at that.
Well, thank you.
Well, let's talk a little bit about your offices. I know that you have several locations in which you practice, and let's talk about those areas. And where are you located?
Sure. So I guess my home base is going to be, at the Novant Health Brunswick Hospital. We have an office right there on campus.
Right.
And certainly spend a good bit of time there. I also have a second office location where I'm at on a weekly basis in Southport.
Nice.
And yes, and it's actually at the old Novant Oceanside Family
On
Medicine.
House Street.
On House Street, that's right. They've relocated, of course, to the
Pine Forest
Pine
area.
Forest, beautiful
Right,
building.
yeah.
But we've taken their old office, and
Right.
we're spending some time
Right.
there, along with, I think, some OBGYN folks over there.
Yes, and urology, I think. Urology, OBGYN,
great.
and surgery, so that's great. Well, you may not know the answer to this, but do we need a referral to see you?
I think I do know the answer. What I'll tell you is some insurance companies may require that. However, you can always pick up the phone and call us, and we'll help you figure it out.
Oh, okay.
Yeah, so-
Yeah, I think there are some insurance companies that may, but I think in general, you don't really
Right.
need one.
It's pretty few and far between. If you're interested in coming to see us, you pick up the phone and call us, and if we can't get you in without a referral, then we'll figure out what we need to do to make that happen.
Well, that's good. I know you have a great office staff. I know your office staff personally, and your office is one of my favorite offices to visit. It's just, they're always so welcoming.
Sure. It's been a pleasure joining this practice down here. I think, I have some senior partners.
Yeah, tell me about those.
Sure. So Dr. Tillotson and Dr. DeSandre and Dr. Scallion
Right.
have been a real presence in Brunswick County for a long
They
time.
have very long time.
And they've taken great care of the patient population down
Yeah, they
here,
are.
and they do an amazing job. And of course, another kind of young guy in the group, I guess, if we're saying that, is Max Beninati, who's fantastic and also trained in minimally invasive approaches. But,
Yeah, we've had him on the show, and I've actually been in the operating room with him, and we've seen the Da Vinci robot, so that's pretty cool.
And he's fantastic and very well trained.
does a good job.
And they're just a great group of folks to work with.
They are very,
the
very
office
nice.
staff is wonderful as well, and it's anytime you leave a job you really liked, and I certainly liked where I was. You never know what you're
Right.
walking into for sure. But I've been really pleasantly surprised with everyone, and I think it's a fantastic practice, and we all have in common that we really enjoy delivering excellent health care
Right.
to the people in Brunswick County.
Well, I can tell you we're very happy to have you here, and especially excited about the new vein procedures that are coming. I think that's something that we've been lacking here in Brunswick County for a while, so looking forward to that. And how might we get in touch with you if we'd like to make an appointment? Maybe we have something we'd like to have removed, a lesion or something. How might we do that?
Sure. Easiest way is to pick up the phone and call our office. Phone number is 910-721-4000.
That's easy.
Yep, absolutely. And they will find somebody that can help you.
Well, Dr. Andy Smith, it's been such a pleasure to get to know you and to have you here today, and I look forward to catching up with you later about those vein procedures.
All right, pleasure's mine. Thank you.
Thank you.